Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What type of asthma is Fasenra used to treat? Fasenra, benralizumab, injection is used as an add-on maintenance treatment for severe eosinophilic asthma. Eosinophilic asthma is a rare form of asthma associated with high levels of eosinophils, a type of white blood cell. Eosinophils help the body fight off infection, however high levels of eosinophils can cause inflammation and other symptoms of asthma to become more severe. Fasenra is an interleukin-5 receptor monoclonal antibody that works by binding directly to the IL-5 receptor on eosinophils. Natural killer, NK, cells then induce cell death and reduce the number of eosinophils in the blood. Fasenra is indicated for the add-on maintenance treatment of patients with severe asthma aged 6 years and older, and with an eosinophilic phenotype. Fasenra is not approved for the treatment of other eosinophilic conditions or relief of acute bronchospasm or status asthmaticus. How is Fasenra given? Fasenra, benralizumab, is given as a 30 mg subcutaneous injection once every 4 weeks for the first 3 doses, and then once every 8 weeks thereafter. Fasenra is available as a prefilled syringe for administration by a healthcare provider. Fasenra is also available as an autoinjector called Fasenra Pen for administration by patients and caregivers who have received proper training in subcutaneous injection technique. In patients ages 6 to 11 years who weigh 35 kg or more, the Fasenra Pen can only be administered by a caregiver or healthcare provider. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.